Hello, dear students and esteemed learners. Welcome to my course on Sociology of Health. And the topic for today's lecture is Millennium Development Goals, Targets, and Achievements. And these goals are specific to the health goals, right? So, we will talk about the health related goals out of the 8 Millennium Development Goals. In the previous lectures, basically we tried to understand first meaning of development and why do we need to talk about the Millennium Development Goals and Sustainable Development Goals. We also try to understand the evolving paradigm of development by taking into consideration the economic growth, economic development, social development, human development, and sustainable development models. Then, in the next lecture of this week, we talked about the Millennium Development Goals. There were 8 goals, and then the indicators and the targets and the interrelatedness of all the goals. Now, in this lecture, we will talk about the health related goals of the MDGs and then the specific achievements in Indian context. So, let's go to the first slide, but before that, let me briefly tell you the concepts or the content that I have covered in this lecture. So, we will be talking about the health related goals like goal number 4, which is reducing child mortality, goal number 5, improving maternal health, and goal number 6, that is combating HIV/AIDS, malaria, and other diseases. So we will talk about all these 3 goals and the specific targets and indicators and achievements in Indian context. Now, let me share with all of you that basically the topic that I have covered today are primarily based on the government data. Because when we talk about the achievements, then the only valid source of data is the data provided by the government. So all the 3 goals, when we will talk about the achievements, we will take evidences from the government data only. And so I would like to acknowledge here that the information about the achievements on various goals and targets are taken from the government report on Millennium Development Goals with the title Final Country Report of India, which was published in 2017. This report is available in public domain, open access, and I have provided the link also here. So anybody interested can access the government website and have access to this report. Further, I have also used some of the tables, then some of the graphs from that source only, right? So that we should have some kind of clarity of the things. Sometimes we used to see the figures, but those are better represented in the form of the graphs. So taken from that very source, and that is the government source. So with this acknowledgement, I would like to begin my presentation or the contents for this lecture. According to the Final Country Report of India, India's Millennium Development Goal framework is based on United Nations Development Group's MDG 2003 framework. That means MDG had more than one framework, and the country report says that our achievements are basically based on the 2003 framework, and it includes all the 8 goals, 12 out of the 18 targets, target 1 to 11 and 18, which are relevant for India, and the related 35 indicators. Now, what is also mentioned there that 6 targets of goal 8, which were mainly related to the landlocked, island, least developed countries, and also for the developed countries, had not been considered for India. So with this kind of understanding and framework, we will try to understand the specific goals, then the indicators and the targets, and the kind of achievement that we have made in Indian context, right? So first we will talk about goal number 4, that is reduce child mortality. We have already seen that the first 3 goals were related to basically reducing poverty, then hunger, then education, etc. Right? We talked about these things in the previous lecture. So when we talk about the health related goals, then we start with goal number 4, reducing child mortality. Now, here we have target number 5, which talks about reduce by 2/3 between 1990 and 2015 the under 5 mortality rate. The indicator mentioned here is under 5 mortality rate. So these are basically data rich content. I will have a look on the data and try to make you understand that. The under 5 mortality rate is the probability of a child born in a specified year dying before reaching the age of 5 if subject to current age specific mortality rate. So in our day-to-day discussion or in academic discourses, we talk about the under 5 mortality rate. That's a very common indicator of the health of the children. But how do we define that very specifically, very academically? That is something that often we don't know. And so I have mentioned the specific definition of this under 5 mortality rate. Majority of the under 5 deaths are neonatal death. Now, what is this neonatal death? Basically, the death which takes place within the first 4 weeks of the birth is identified as neonatal death, right? So, within the larger framework of under 5 death, a big section or a big proportion is taking place as the neonatal death. In addition to this, the under 5 mortality rate is sensitive to nutritional status of the mothers, the level of immunization, availability of child and maternal care services, and economic condition in the family. So we know that out of these factors, most of the factors are basically social and socio-cultural, but one thing which is very important here is immunization, right? So if the child is not getting the appropriate vaccination at the right stage, or if the mother has not received the appropriate or the required vaccine at the right stage during the pregnancy, then that basically adversely affects the health of the newborn or maybe the unborn fetus or the mother also. And any kind of problem in this is creating a kind of mortality in the child, maybe at the neonatal stage or maybe after that. So this is something that we need to understand. Now, we will talk about basically the assessment and the achievements in this particular target. The under 5 mortality rate was estimated at 125 deaths per 1,000 live birth in 1990. So, as we have the targets which are relative, we need to know what was the prevalence during the 1990, which is considered as the benchmark year. So here it is mentioned that it was 125 deaths per 1,000. So the Millennium Development Goal target for under 5 mortality rate was 42 deaths per 1,000 live birth by 2015, because we need to talk about the 1/3 of that. As per the SRS 2015 report, the under 5 mortality rate was at 43 deaths per 1,000 live birth and was very close to the target. So the government report says that it has taken the statistics from the SRS report, that is the sample registrar system report, and those information basically help us to understand that we have achieved this particular goal. The under 5 mortality rate for rural areas is higher than that of the urban areas. In 2015, the rural under 5 mortality rate was 48, whereas the urban under 5 mortality rate was 28. However, even if we have achieved the target in terms of the overall prevalence, but we are somehow witnessing the problem of disparity, the rural urban disparity, which is quite visible in these figures. Basically, the prevalence in the rural areas much higher than the prevalence in the urban areas, and that shows kind of disparity. Going beyond that, we can find other forms of disparities also, which I have highlighted in red because those are very important. The under 5 mortality rate among female was higher than that of males at all India level. Among the females, it was 45 and male 40. As well as in a rural female, 50 and rural male 46. And urban areas, female 31 and male 26. Now, when we look at the gender aspect as well as the spatial aspect, we get to know that the rural females are having almost like double the figure of the urban urban male, right? So because among the males and females, the females are having the worst performance, and between rural and urban, the rural is having the worst performance. So if we see the kind of intersectionality, then we happen to find that the situation is a very dismal or problematic for the rural female, and that is why we used to see such an adverse sex ratio in India, right? So understanding the under 5 mortality rate, and especially looking at it from the gender and spatial perspective, gives us a very comprehensive understanding about what is happening at the grassroots level. However, in terms of the overall figures, India is close to the Millennium Development Goal target. Now, here I have included a graph that I have taken from that government report itself, and it helps us to understand the prevalence of the under 5 mortality in states of India, right? So we can see in this graph that Madhya Pradesh is at the top with the highest prevalence of under 5 mortality rate, which is as high as 62. And Madhya Pradesh is basically followed by, or at the same place is Assam, where the prevalence is also 62. And then we have Odisha, and then Uttar Pradesh, then Rajasthan, and then Bihar. So all these major states have basically poor performance in terms of minimizing the under 5 mortality rate. Whereas some of the best performing states are Kerala, where it is 13, the minimum. Then Delhi and Tamil Nadu have 20 each. Then Maharashtra has 24. So these figures help us to understand the disparity which is prevailing in terms of the various states. Then we come to next target, that is target 5, reduced by 2/3 between 1990 and 2015 the under 5 mortality rate, and the indicator here is infant mortality rate. The infant mortality rate is the number of deaths in children under 1 year of age per 1,000 live births. High neonatal, that is less than 29 days, that means 4 weeks, basically 4 weeks after birth. So this high neonatal mortality still continues to be a significant contributor to the infant mortality rate. That means the high neonatal mortality is the significant contributor in infant mortality as well as under 5 mortality. Now, what are the achievements? In India, infant mortality rate was estimated at 80 per 1,000 live birth in 1990. So, as per the SRS, the IMR is at 37 vis-a-vis the target of 27 infant death per 1000 live birth by 2015. So when we calculate the figures as per the requirement of the indicator, we get to know that the target was 27 infant death, and in India we are at 37, or we were at 37. That means that we were far away from achieving the goal, right? India has not successfully achieved the goal of reducing the infant mortality rate as per the requirements of Millennium Development Goal, goal number 4, reduce child mortality. This country report is saying this. Now again, we can have a look on the prevalence of IMR in terms of the states. And again, we see that at the top is Madhya Pradesh, followed by Odisha, then Rajasthan, then Bihar. And then in terms of the best performing states, we happen to see that it's Kerala, Delhi, Punjab, Karnataka, right? So if we try to look at this graph, we happen to see that the prevalence rate in Kerala is 10, whereas the prevalence rate in Madhya Pradesh is more than 45. That means if we try to compare the states of India, then the prevalence in some of the states is more than 4 times than the prevalence in some other states. That means the interstate disparity is the biggest challenge. Some of the states have performed very well, whereas some states are actually lagging behind. Then we move to goal number 5, that is improve maternal health. And here the target is reduced by 3 quarters between 1990 and 2015 the maternal mortality ratio, right? MMR. And the indicator is maternal mortality ratio. Now we need to understand what is maternal mortality ratio, and you need to notice it that MMR, when we talk about MMR, then the R is not referring to rate but ratio, right? Maternal mortality ratio. The MMR is the number of women who die from any cause related to or aggravated by pregnancy or its management, excluding accidental or incidental causes during pregnancy and childbirth or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy, per 100,000 live birth. Now, there are 2-3 important things here when we talk about maternal mortality rate or ratio, basically maternal mortality ratio. Then first thing is this, the denominator is basically per 100,000 live birth, right? It's not about 100, it's not about 1000, it's per 100,000 live birth. Second important thing is this, that we are talking about death of the mother during pregnancy and childbirth or within 42 days of termination of pregnancy or maybe the delivery of the baby, right? So when any kind of death is occurring except the death caused because of the accidental or incidental causes during this period of pregnancy or within 42 days of that, then this is considered as maternal mortality and we calculate MMR. Most maternal deaths are avoidable as the healthcare solutions to prevent or manage complications are well known. But in India, there was a history of high prevalence of MMR, and there are so many reasons related to that. We will talk about some of these things when we will exclusively talk about the maternal health and reproductive health. But you may remember when we were initiating this particular week's classes, then we were talking about the background. And then at that time, we also talked about the ICPD conference, and there we were talking about the reproductive rights and reproductive health. So this maternal mortality could be controlled by improving the reproductive conditions, improving the child delivery, and including the services of the medical care and healthcare providers. So, what are the achievements and assessment of this situation or of this goal? The MDG 5 stipulates that MMR level be reduced by 3/4 between 1990 and 2015. Now, in 1990, the estimated MMR was 437 per 100,000 live birth. In order to meet the MDG target, the MMR should be reduced to 109 per 100,000 live birth by 2015. So the target was to reach to the number 109. Now, what is the achievement? As per the Office of the Registrar General of India estimates, the MMR status at all India level was 167 in 2011-13. So there are two situations. One is this, that this 167 is much more than 109. But there is another situation also, which is the year in which we have taken the data. Because these data are not taken frequently, the government also has to depend on the official statistics which is provided by certain agencies and that is calculated by certain agencies. So the last updated data for this reference was taken from the reference year 2011 and 13. That means some improvement could have been seen in next 2 years, but at the time of basically making this assessment, that was not available. Then here is a graph which is showing the performance of the various states or the relative performance of the various states. And again, we can see that Assam, Uttar Pradesh, Rajasthan, Odisha are among the states which have not performed well. Whereas Kerala, Maharashtra, Tamil Nadu, Andhra Pradesh, Gujarat are the states which have performed well, because these states, Kerala, Maharashtra, Tamil Nadu, Andhra Pradesh, Gujarat, West Bengal, Haryana, Karnataka and Punjab are having below the national average. Whereas the rest of the states like Bihar, Jharkhand, Madhya Pradesh, Odisha, Rajasthan, Uttar Pradesh, Assam, they are above the national average in terms of MMR. I need to acknowledge here that these graphs and charts that we are basically discussing are also taken from that government report. Then we move to the next indicator, which is proportion of birth attended by skilled health personnel, right? Because one of the reasons or causes of maternal mortality during pregnancy or childbirth or even after that, but which is identified as maternal mortality, is actually the absence of the skilled health personnel during the childbirth. Because in India, there is a practice of child delivery at home. And so there is one very important intervention, that the child delivery should take place in institution, which is also known as institutional child delivery. Or if that institutional delivery is not possible, then the childbirth should be attended by the skilled health personnel. And so this is a very important indicator. What is the proportion of birth attended by skilled health personnel? The proportion of birth attended by skilled health personnel is the percentage of deliveries attended by personnel trained to give the necessary supervision, care and advice to women during pregnancy, labor and the postpartum period, to conduct deliveries on their own and to care for the newborn. So this is how we can understand this process. Skilled health personnel include only those who are properly trained and who have appropriate equipment and drugs. Now, why do we need to talk about this? Because very often in the villages, in the rural areas, we have the conventional ladies, older ladies, who are often known as the dais, and they are somehow taking care of the delivery processes, and that is where the problem is primarily lying, right? And so this term is defined very well because this is an indicator. Now, what are the achievements and assessment? For this indicator, there is no benchmark value to be attained by 2015. However, for attaining the prescribed target for MMR, the desirable level of attainment for this indicator is taken as 100% by 2015. That means it was decided that 100% of the births should be attended by the trained health personnel, right? Whether in the form of institutional delivery or in the form of the presence of the trained personnel at the time of the birth. Now, what does the figure suggest? The NFHS for 2015-16 showed that at all India level, 81.4% births were assisted by a doctor, nurse, or LHV, ANM, other health personnel, right? So basically, there are trained people which are known by different terms in different contexts, right? But the point here is this, that 81.4% births were assisted by the doctors or the trained professional. So we are closer to the target but not completely achieved that. Then we come to the goal number 6, which is talking about combating HIV/AIDS, malaria, and other diseases. And this is very important from the perspective of these diseases, because these are the communicable diseases. And we have been talking about communicable diseases because these are very difficult to control, right? In many lectures previously, we talked about the problems related to communicable disease. And when we were talking about the public health theme, then also we mentioned that we need to have a larger intervention, and this communicable disease cannot be controlled by applying only curative medicine. We need to have a larger setup, a social setup for their prevention and control. So these targets are very important, and now we will talk about these. Target 7 have halted by 2015 and begun to reverse the spread of HIV/AIDS. That means by 2015, the spread should be stopped and then reverse the spread of HIV/AIDS. And the indicator basically is adult HIV prevalence in the age group 15 to 49. Now, what are the achievements and assessments? In 2015, the national adult, that is the 15 to 49 years age group, HIV prevalence was estimated at 0.26%, and that was varying between 0.22% to 0.32%. And adult HIV prevalence was 0.30 among males and 0.22% among females. At national level, a decline has been observed in the adult HIV prevalence over the years. I've also mentioned here that the consistent declines are noted both in males and in females at the national level. So we can see that the prevalence is there, the figures are there, but at the same time, there is we can see the silver lining that the prevalence rate is declining. Then the next important indicator here is basically the use of condom to overall contraceptive use among currently married women. Now, this indicator is important in the sense that use of the condoms actually create an environment in which the transmission of HIV virus is not possible. So there are different means of contraceptives used in India. However, many of those means, like the oral pills, these are not successful in preventing the communication of the virus. That is why this indicator came into existence, and this is very important. Now, what are the achievements? According to NFHS 4, in 2015-16, the condom use rate of the contraceptive prevalence rate among currently married women in the age group 15 to 49 is only 5.6% at all India level, vis-a-vis 5.2% in 2005-2006. Now, there are two important information here. One, that the prevalence is 5.6%, which is very low. And what is even more problematic, that the achievement in last 10 years, that is from 2005 to 2015, is also much lower, because the prevalence was 5.2% in 2005-6, and this is remaining confined to 5.6% in 2015-16. That means this indicator is not fully functional, and that is why we need to talk about the reproductive health. That is why I had mentioned the ICPD conference and its relevance, because it needs not only education and awareness, it also needs empowerment of women. And the ICPD conference is talking about this, and the MDG goals are talking about this. And you may remember, one of the goals of MDG is also related to empowerment of women. So this graph is basically showing you the prevalence of HIV prevalence, and this one is showing you HIV prevalence among pregnant women. Then we come to next target, that is target 8, have halted by 2015 and began to reverse the incidence of malaria and other major disease. So the indicator here is prevalence and death rate associated with malaria. And what are the achievements? So the report says that the incidence of malaria in the country started declining as cases was brought down from there is a big number, basically 2,031,790 to 1,090,724. The annual parasite incidence per thousand population has declined from 2.09 in 2000 to 0.64 in 2015. So this is the achievement in terms of malaria. And when we talk about the other disease, then this is basically tuberculosis. India accounts for 1/4 of the global tuberculosis burden, that is the TB burden. In 2015, an estimated 28 lakh cases occurred and 4.8 lakh people died due to tuberculosis in India. The mortality due to tuberculosis per 1 lakh population is 17 in 2014 against 39 in 2000. So here we can see that there is a huge success, that this mortality has reduced. It was 39 in 2000 and it is 17 in 2014. So we can see that in terms of controlling tuberculosis, we are successful at the level of the country. And then this is one more slide which is showing the burden of tuberculosis global and India level. And finally we came to the last slide where we have to think about this problem. So what are the benefits of studying Millennium Development Goal, health related goals, targets and achievements? Think about it. And the activity question is, try to find the relationship among all the goals of the MDGs. So this is all about this specific topic, and hope you appreciated the contents. And if you want to know further, then I have repeatedly said that all the details are there in the government report, as I have acknowledged in the first slide. You can go check the details. So till then, take care.